Are you suffering with fibroids or fibroma or tumors or any kind of cyst in the uterus or anywhere else? Then this video is for you. Treat your tumors or treat your cyst or treat your fibroids with homeopathy naturally without any operation or without any surgical measures. It is completely 100% safe and it has zero side effects and it does not give you any kind of um, tension or any kind of insecurities. Of course, homeopathy is not known by so many people, but when you know, you try to believe it because homeopathy acts as wonders and it also acts as magical thing. Okay, without any delay, in today's topic, we'll talk about fibroids. Myself, Dr. Megha from Homeopathic Clinic, and I'm a practitioner of homeopathy from 5 years. Today, I'll be talking about some of useful remedies which are really helpful in the treatment of fibroids. If you have any kind of concern, you can just comment on the comment section. You can ask me about your problem. I am going to give you a free consultation how you can really kind of cope up with the homeopathy. So, without any delay, let's talk about fibroids. First remedy I'll be talking is calcarea os. Fibroma of uterus, fibroids of uterus in fat and fleshy women, means the women who are very obese and who are always fat, who has this kind of PCOD problem, who does not get their periods properly. When they go for an USG pelvic and abdomen scan, they discover that they are suffering with the fibroids. And it is always given for the fat and flappy person because calcarea means it's a flat and flappy. And it is also given for the women who are under the menopausal period. Great depression and anxiety. This remedy also shows the depression because the uterus is being affected in the female organs, means it is being directly connected to the mental symptoms because it's a direct connection. Even the PCOD happens for the people because of the mental depression, grief, sadness, disappointed love, anxiety, fear, or any kind of hurt which they had went through. So it is also a remedy which can be considered with the depression and anxiety, with flat and flappy, with fibroids. Next remedy is calcarea iode, the same family but different. That is arsenic, this is iodine. Arsenic is given when there is burning, depression, fear, and lack of confidence and everything. Iodine is given when there is a small fibroids with yellow vaginal discharge, may experience menstrual colic before the start of menstruation, and they may be also suffering with this thyroid problem like hyperthyroidism or hypothyroidism, any kind of goiter and nodular goiter, any kind of thyroid issue. Then also you can give without the thyroid issue. Also you can think of calcarea iode, or you can also give it as a supplementary when you are giving an constitutional remedy. Calcarea self, of course it's not given very repeatedly. Fibroid and cystic tumors. Next one is conium mac, fibroma of the uterus in old maids and bachelors around the change of life. When there is a change of life, it is given, and we also give this conium the patient who are going into so much of depression, who does not tend to express their emotional feeling outwardly, or they always keep their emotions or the feelings, means if someone says bad to them, they're not giving it back to that person, they does not talk back, they keep it to themselves, they think about it, they think about the thing which they went through, and they will be always thinking about it, they will be always suppressing their emotion in front of others, they are not expressive, they are not kind of talking out That time, because of this suppressed emotions, this fibroid happens in coniac people. The case taking is very important in the fibroid thing, because fibroid does not happen because of one or two cause. It mainly happens because of mental cause. So to know the mental cause, you should know the patient very better and well. The patient will not never say that I went through this, after this happened. No, even if you ask, yeah, do you went any kind of mental thing which you had been troubling you, they say no, I'm happy, even when they are not happy. So it's your job to rule out what is the cause. So only you can give coniac. If not, you just go with the remedial selection. If you want to go with the constitutional, like deep acting remedy like conium, calcarea, and everything, then go with the proper case taking with perfect mental cause. Next, moving on to the iodine. Fibroid of uterus with uterine hemorrhage, irregular menstruation, and there is so much of pain. The patient goes to doctor because of the pain, not because of anything. They say that they have so much of pain, I does not know why, and they go to the doctor and they come to know about it. These patients will be so much emaciated and weak looking, and there will be so much of darkness of eyes, and they will be eating well, but they are not like eating well look kind of patient. So that time you can think of iodine. Calibrome, fibroid of ovaries with loss of desires and memory. Lacasis also you can give, but case taking is very important when you're giving lacasis, iodine, conium, and everything. Short painful period and intolerance of clothing or cover over the stomach area. Symptoms are revealed on start of menstruation. It is particularly useful at menopause. The lady who had been very premenopausal symptom, that time they just go for the checkup. 3 to 4 months I'm not getting periods, this that, I'm getting hot flashes, and I'm sweating so much, there's so much tiredness, there's so much of mood swings, this that and everything. When we do the USG scanning, we comes to know that the patient is having a fibroid. That time you can think of lacasis for the menopausal women who are also having this short painful period and intolerable in clothing and moody changes. They are very hungry women, they always like to quarrel with others, they are very talkative, like that. Then you can think of lacasis. I'd also given lacasis for one patient who was so quarrelsome. Even with me she was quarrelsome, but she used to come next visit. I was like, why you're coming to? Because you're already quarreling, you're not satisfied, but why you're coming? But they quarrel with us not because they're not satisfied. It's just their nature, that's all. So it was cured within 6 months. So proper case taking is very important, and understanding that case is also very important. Sickle cord, fibroma of uterus, painful menstruation, pain revealed by cold application on the abdomen and uncovering it. Continuous oozing of watery blood from vagina. This is also a very peculiar symptom of sickle cord. Urine may be suppressed. Fibroid with bleeding of thin, full smelling, watery black blood and feeling of it in the body. This is also one of the major and mostly used symptoms for sickle core. I had not given sickle core for anyone. You can try it out. Silicea, it uses it is mainly for the management of fibroid conditions, like after the treatment you can give silicea, or before the treatment you can give a silicea, like that. Next one is tuja. Spongy fibroid, rapid exhaustion and emaciation, chilly patient, sensation of movement of something living inside, and profuse leukorrhea will be there. That time you can think of tuja. Tarantula, large fibroids, heavy periods with pain occurring early and restlessness. Triplinum pendulum is also given in the mother tincture form when there is a bleeding from the fibroids. Then you can give triplinum pendulum mother tincture. Of course, I have not said any mother tincture for fibroids, only this one. You can give 6x 3x potency, or you can go with the lower potency like 6CH, or you can go with 200 1M 10M also, but go with a proper case taking and proper medication with proper potency, because the potency selection is also very important. The repetition of dose is also very important, because the patient will be very sensitive in this chronic diseases. Okay, that's all for this video. I think I was very helpful for some people. So please do like and subscribe, and don't forget to press on the bell icon so that whenever I put a new video, you will be notified. Myself, Dr. Megha from Homeopathic Clinic. If you have any kind of disease which you want to know about homeopathic treatment, please do comment on the comment section. Thank you.